say cheese? Hello, I'm Dr. Neetu. I'm a registered dentist practicing in the UK. I am also a first-time mom. My baby girl is 4 months old. As a dentist and a mom, I know how frustrating it can be and how difficult it is for parents during this time. And without the proper professional advice, even the silliest of matters can become a nightmare. I hope to fix this by giving straightforward, raw facts and easy to follow, simple dental advice and advice related to babies as much as I know as well. In this video, the topic of discussion is, as I mentioned earlier, teething in babies. The what, when, why, and the how. How to effectively relieve or soothe your teething baby. I will also be answering a few commonly asked questions by parents, and most importantly, what ingredients to avoid in teething products or teething medications, gels, granules, and the lot. With a vast number of products available today in the market, it is so overwhelming, even as a dentist, to find what is good, safe, and effective for your baby. So that is how I hope to help you with this video. To understand why our babies suddenly turn into little devils or monsters and become so needy and clingy, we need to know what's happening behind the curtains of teething, the what and the why. So simply put, teething is the baby tooth moving from its position within the bones in the jaw to its position in the mouth by cutting through the gums. The jaws are simultaneously growing to accommodate all the future teeth, and also the bones need to start shrinking, they need to start thinning down so that the tooth can easily maneuver itself through all those layers and come out through the gums into the mouth. So can we take a moment to say ouch and empathize with our babies, because this is actually what's going through. This is actually what they are going through, and all of this builds pressure within the gums, within the bone, and it's this pressure that kind of gives them that ache and that uncomfortable, irritable feeling. Okay, so now let's head into the when. When to start expecting teething symptoms in your baby. There's actually no a cut and dry fact there, but the whole process takes approximately 2 to 3 years. The first tooth erupts into the mouth at around 6 to 7 months. I will just give you an example of the age and order in which teeth erupt, so that you can kind of expect or know where teething might start. Now the symptoms, coming to symptoms. Most I think that parents know is irritability. Their calm babies suddenly become fussy all of a sudden. The second one is excessive drooling. Excessive drooling is a major issue because not only does it spoil clothes, but it also causes drool rash on the neck and the chin region, which can become a bit traumatic to parents to control, but it is actually a sign of teething. And to control excessive drooling, of course, bibs are the best way to go. Now, when you do buy bibs, make sure that they are situated very close around the neck so that there's no gap or wedge for the drool to pass through. I will show you a few of my favorite bibs. So a few bibs that I swear by. This is a bandana bib. So when you buy a bib, a few things to note. If you buy ones with multiple fastenings, multiple press buttons, then you can kind of adjust it around your baby's neck, make it tight or make it loose as necessary. If you just buy one, if you buy ones that are not adjustable, they might be kind of, not useful as they grow big and their neck muscles become more established. So, and also another thing to make sure when you buy bibs for excessive drooling is to make sure they are super absorbent. They have a very absorbent backing. And because this cloth is going to be on your baby's skin for a long amount of time, try to go for 100% cotton or muslin fabrics, or at least more than 50 to 70% cotton, so that there isn't any irritation on baby sensitive skin. Another bib I love is this popover bib. Now the best thing about this is the elasticated rim. It's so easy to put over the baby. You don't have to pick up the baby or crank its neck to tie or to fasten the buttons behind the neck. You can just pop this over. You don't have to pick up the baby either for that. The abstract patterns I love, and the elasticated rim, as I said, they have a close fit to the neck, but it's not too tight that it irritates baby's skin or irritates baby. And you get 3 for like £3.50 in Asda, which is a bargain, I would say. So just as I spoke about the drool rash, you will also find redness, kind of like a mild sunburn rash on the cheeks and the chin area. This is also because of teething, and it can also be because of the drooling. Now another symptom is a sudden increase in biting, chewing, sucking behaviors. Especially if you're a breastfeeding mom, you will know when your baby starts to bite. And a good way to prevent this is you can use nipple shields, or when baby bites, you can say ouch and just temporarily for a few seconds unlatch your baby so that baby knows that behavior is not acceptable. Another symptom is disturbed sleep and a disturbed routine overall. It necessarily need not be just a sleep routine, but in the morning, the nap time is not corresponding to the routine baby followed yesterday. Baby is really clingy and needy, wants extra comfort feeds all of a sudden. This is another symptom. Some babies might start rejecting feeds, especially breastfeeding babies. What actually happens is sucking does, they need to exert some pressure and some force while sucking. So sucking can sometimes increase the ache or the pain, and babies might start rejecting feeds because of this. Breastfeeding mamas, what you can do is you can try to express your milk and offer baby a bottle and see if this soothes them. There's no need to panic if your baby is putting on the right amount of weight. A few other uncommon symptoms are face rubbing, ear pulling. Coughing is also associated with some babies. So if your baby is showcasing a combination of these symptoms, it is likely that baby has started teething. Another misconception that parents have is high fevers are common during teething. No, they are not. Absolutely not. If your baby has high fevers, especially on and off, please do get the proper medical advice from your GP or your pediatrician. Now, I've made a list of the most commonly asked questions regarding teething. A popular question asked by breastfeeding moms are, do breastfed babies get teeth later on? Is it delayed? No, the type of feeding does not dictate the teething process at all. If your baby was premature though, I would say that the teething process might be a bit later on, and you should not compare them with a normal healthy baby, but otherwise no, breastfeeding does not delay teething whatsoever. An important question that parents ask me is, when should I be concerned? How late is too late? So this is an important question. As I mentioned earlier, babies can show teething symptoms as early as 2 months, 3 months, and premature babies can get this later on. Every baby is different, so it's best not to compare one baby to another because there are so many facts and rules, but every baby is an exception. They have his or her growth chart, their own percentile of growth, so there's no need to panic if your neighbor's baby started teething and your baby has still shown no symptoms. But beyond 15 months or 18 months, I would say that is a time to be slightly concerned. I wouldn't say go into full panic mode, but you definitely need to get your baby consulted by a pediatric dentist or at least your pediatrician. The next question is another misconception. Why does the pain get worse at night? The reason why parents feel so is there are fewer distractions in the night. to keep the baby's mind off the teething pain. So that is a reason why several parents feel that the pain gets worse at night. But this is the truth behind that. The only time pain can get worse is, as I mentioned earlier, the large molar teeth, the chunky teeth, they come out at around 12 months to 14 months. Because the surface area of this tooth is larger than the other smaller teeth, it needs to cut through more gums. I hope that makes sense. So the larger teeth are definitely gonna worsen the pain. That is the only time the pain is gonna become worse. At this time, there can be associations of mild fever, but never a high fever. I do want to repeat myself again. High fevers need to be checked by your pediatrician or your GP. Now coming to the most wanted question of all, what remedies actually work? What is the most effective way to soothe your baby in pain? So the first and the best remedy, hands down, is giving your baby a good gum massage. There are several ways you can do this, several things that you can use, but the best, of course, is a clean finger. Now, how massages work are, as I explained in what teething is, there are so many things happening within the gums within such a narrow amount of space. There's a lot of pressure built up underneath such less surface area. It's almost like a bubble trying to burst. So this pressure is only going to keep on building up and building up until the tooth can finally emerge outside. Whew, freedom! So until then, the pain is just gonna be radiating all around the jaws, the bones, maybe even it can also radiate to the ears. That's why some babies tend to pull their ears, because it's irritating them and it's aching. So when you apply counterproductive pressure, it gives a temporary relief. That's why gum massage is the best way to relieve teething pain. So I spoke about gum massage and how it's the best remedy, hands down. The second at-home remedy is, of course, a chilled or frozen washcloth. Now, I must say that whatever you are freezing for the baby to chew on or hold, please make sure that you get it to a chilled temperature, because extreme temperatures can cause skin reactions to baby. So chilled washcloth, what I do is take a towel, which is kept specifically for baby, not something you remove your makeup with and give to baby, okay? So it can be a face towel. What I specifically use is, this is a cotton liner. This is something I bought for baby's reusable nappies. Don't worry, this is not something I took off her bum. This is something I kept separately to use as a washcloth for her teething. So what I do is I dip this in water, I drain it of excess water, I roll it up, and then because I do not want it to come into contact with the contents of my freezer, I put this into this is a breast milk storage bag. I put this into this bag and put it in the freezer. If you get sterilization pouches, and I'm pretty sure most mamas, breastfeeding mamas, have these bags lying around somewhere. This is a hack that I do for myself, for my baby. Another way is to chill, or if you have frozen vegetables, the best would be baby carrots. If your baby is already on solids, then you can get a silicone mesh, which is like a big, huge dummy. And you can put pieces of fruit or frozen vegetables into that, close it up, and give it to baby to chew on, suck on. It slowly releases the juice of the fruit, which will keep babies love sugar, babies love fruit. So that will kind of keep baby distracted as well, and the chewing will help with their teething problems. The next remedy is, of course, something you do need to go to the shop for, or you can find it on Amazon, or teething toys. Now, I do not have to get into the subject because most parents know what's best for their children. I think teething rings, newbie teething keys, these are all really popular. I'm just going to mention, there are products that I love though, personally, and I will be putting a product review in a separate video. This is too long as it is. So, but the things that you have to look out for are, make sure that the teething product follows regulations. It is PVA, BPA free. It's hard rubber or silicone. It can be easily sterilized, because I personally dislike, Teething products that are filled with water or gel, which you can easily freeze. There are two reasons why I dislike them. One, because of the gel and the water component, they cannot be sterilized, steamed, or boiled. Second, liquid-filled toys tend to break under pressure. So that's also a reason why I do not recommend them. What I don't like for my baby, I do not recommend for any other babies. On a serious note, especially for parents who are experimenting with the different kind of products now, there are amber necklaces, bracelets. Apart from the scientific basis, whether it is a fact, it's a truth or not, I'm not dwelling into that, but they can be a real, a serious choking or a strangulation hazard. So please do, if you are experimenting with these, please do make sure it's always under supervision. You are supervising your baby at all times. I do not recommend these products whatsoever, but if you are experimenting with them, mama and dads out there, please make sure that it is under supervision. Going to over-the-counter medications like teething gels, teething granules. I know there are so many out there. There are a few ingredients though I have to warn parents of. These ingredients are a serious no. So please do read the labels if you are experimenting with any of these. Now, the three main ingredients you have to stay away from are benzocaine. Benzocaine is a local anesthetic. It is a numbing agent and it has serious adverse effects for babies, so that is a definite no-no. If you're going for herbal remedies, please make sure there is no belladonna. It is a poisonous substance in the product. And another product to stay away from is xylitol. That is an artificial sweetener. It also has serious long-term effects for a baby. Some babies are allergic to it and parents don't realize what their babies are reacting to. So please do stay away from these ingredients. So these are the common questions. The product reviews, I will add them into another series or another video. I hope that these information help you and your baby.